Hello, welcome to today's episode. Today I will talk about the health effects of oral sex. So what is oral sex? Oral sex simply means what? Using your mouth, your lips or your tongue to stimulate your partner's genital or anal area in order to give sexual pleasure. And we know there are so many common names that are used for oral sex. We have 69, giving head, we have BJ, and so forth. Do you know we have official medical terms that are used to describe the various forms of oral sex? The first one is cunnilingus. And what this means is what? Giving or performing oral sex on the vagina, the vulva, or the clitoris. Then we have fellatio, which simply means performing oral sex on the penis of a man. Then we have analingus, which simply refers to oral sex that involves the anus. So is oral sex in the traditional sense? Typically, the younger people are tempted to believe that it is not a form of sex. Maybe because it does not lead towards pregnancy or does not involve the penetration in the traditional definition of intercourse. However, please note that oral sex is a form of sex. It is considered a type of sex. This is because it involves either sucking or licking of a partner's genital or anus, and in the course of doing this you come in contact with the genital fluid of the partner, not only the genital fluid and sometimes the feces as well. And this exposure is a similar occurrence that happens in sexual intercourse, and this increases your risk of contracting sexually transmitted infections if the partner has it. And when it comes to anal oral sex on the anus, it is always important to know that no matter how clean the anus looks like, there is still the risk of contracting sexually transmitted infection. So let's look at the various sexually transmitted infections that you could contract through oral sex. My name is Christiana Mausi Sairam, a public health practitioner and a Fulbright scholar. Okay, so the first one is the human papilloma virus, simply put, the HPV. This is a very common virus which we know has so many varieties or so many variants, more than 100 variants, and some variants are known to cause cervical cancer in women, and it can also cause genital warts. And genital warts, they are like cauliflower-like growths that could appear on the genitals or any part of the body, and this can happen to either a male or female. Please remember that when it comes to oral sex, it is not limited to only women or men. A man or a woman can either give or receive oral sex. Then the next one is cervical cancer. Yes, so HPV we all know can cause cervical cancer in women. Then oropharyngeal cancer, or simply put, cancer of the mouth and the throat. And it's important to note that statistics from the global cancer registry data is indicating an increasing incidence of HPV positive oropharyngeal cancers. Simply put, statistics is showing that the people who are getting cancer of the mouth and the throat has been linked to what? HPV virus. So HPV is causing what? A lot of mouth and throat cancers these days. And in Ghana, we are beginning to get a lot of younger people, mostly men, younger people in their 30s and their 40s who are developing throat cancers. And when you look at their history, or when you take your history, you realize that they do not have other risk factors for throat cancers, such as smoking, previous history of smoking, alcohol use, and so forth. However, most of them were exposed to what? The HPV virus at a younger age. Remember, when you are exposed to HPV, it remains dormant for about 10 to 15 years before it will cause some form of disease. So once they get to their 30s and 40s, then they begin to develop these cancers. Throat cancers commonly occur in men who are above 60 years, but that trend has changed now. We are seeing it more in the younger men. So it's important to take caution or have protective oral sex. Then the next form of cancer is penile cancer, or cancer of the penis. That can also result if you are exposed to, or if you are infected with what? The HPV. Then we have cancer of the anus, cancer of vagina, vulva, and so forth. Then the second sexually transmitted infection is hepatitis A. And hepatitis A is transmitted through fecal-oral route, which means if you come in contact with the feces of somebody who is infected with the hepatitis A virus, you can be infected with the virus. So if you engage in anal licking or oral sex on the anus of somebody who has hepatitis A, the virus will be passed on into your mouth, and then it enters your body, then you become infected as well. Then the next one, we have gonorrhea, chlamydia, hepatitis B and C. And interestingly, sometimes we get clients who come to the hospital with strep throat or sore throat. So when you take a swab to the lab, you realize that they are actually suffering from what? Gonorrhea or chlamydia, or sometimes even both. So if your throat comes in contact with, or if you swallow, or semen or any genital fluid of an infected person, that can lead to what? Gonorrhea or chlamydia of the throat. And sometimes if you receive this genital fluid, if they touch your eyes, they enter the membranes of your eyes and then straight into your bloodstream. So you can also be infected through that means. Then we have herpes. Herpes is a very common sexually transmitted infection, and it comes in two forms. You can either have oral herpes, genital herpes, or both. And either of these can be contracted through oral sex. So if your partner has blisters or cold sores around his mouth or nose, and he gives you oral sex on your genital, it means the herpes virus will be passed on to you. Same way, if the partner has genital herpes, meaning he has some sores or blisters around his genitals, and then you give him or her oral sex, the virus will be passed into your mouth and then into your body system. Then we have others such as syphilis, HIV. All this can be transmitted if you have unprotected oral sex. So what are the signs and symptoms we should look out for this sexually transmitted infections? If you see a rash, blisters, or lumps on your genitalia, you should report, or on your mouth. And typically for the cancers, the earliest sign you see is what? Lump, either in your cheeks or lumps on your tongues, or any abnormality. If you see any rash, you should seek medical care. Early detection is very important. Then there could be discharge from the vagina or the penis. If you have any abnormal or unusual discharge, you should report for medical care. Then pain or irritation or burning sensation during urination, that should also prompt you to seek care. Then sore throat, abdominal, or pain in your testicles, that could be pointing to any of these sexually transmitted infections. Then bleeding in between periods. And hepatitis A, B, and C affects the liver. So you should also look out for signs such as dark urine, or yellow eyes or skin, or jaundice, simply called jaundice, or if your feces are pale, or you have flu-like symptoms, because they are hepatitis A, B, and C are viral conditions or viral infections. You should expect flu-like symptoms such as high temperature, high body temperature, joint pains, malaise, weakness here and there. Then it is important to seek treatment as soon as you detect any of these symptoms, because please always remember that not all these sexually transmitted infections are curable. Some are not curable. However, there are medications that can be used to manage the symptoms. So it's important to report early. If you leave these sexually transmitted infections either partially treated, maybe you go and buy your own drug and treat it partially, or it is left untreated, it can affect your fertility, it can lead to infertility, it can affect your baby. Even if you get pregnant, it can cause eye infection of your baby. It can cause what? Miscarriages as well. So it is very important to seek treatment. And please know that sometimes you may not show any signs or any symptoms of these sexually transmitted infections. However, if you have had oral sex with a partner, a new partner, or somebody you barely know, or your partner is having affair with another person, it is important to get yourself screened to be sure you are treated, you do not have these STIs. Please contact me on christiana.achu@fulbrightmail.org. If you have any questions or comments, please email them to me, or you can also call or WhatsApp this number 050-174-2759. 050-174-2759. Thank you. Our next video will be on how to reduce the risk or the health effect, how to reduce some of this risk of getting sexually transmitted infections through oral sex. Thank you.